Thank you for joining us tonight at 10. I'm Molly Hudson. The Omaha community is beginning to heal from Tuesday's Target store shooting. No one was killed or hurt except the shooter, 32-year-old Joseph Jones, who was shot by Omaha police officer Brian Vanderheiden. Yesterday, I spoke to Jones's uncle, who told me he believes this could have been prevented if mental health resources were more available for his nephew. So what do mental health resources look like in our community right now? I talked to Region 6 and UNMC to see how accessible resources are and their concerns.
Most people with mental health are not violent. Most of them actually are just our everyday family members and neighbors.
Dr. Howard Liu with UNMC says there's been a surge in the last decade of people seeking mental health care, but the capacity is not keeping up.
Well, you can't have mental health access if you don't have a professional to see somebody, right?
He says the shortage of providers was bad before the pandemic and has only grown worse, but recent ARPA investments in the Behavioral Health Education Center for Nebraska may change that.
That group really works full-time to make sure that across the state, from rural small towns to South Omaha, North Omaha, that we have access to a pipeline of new providers, whether that's counselors or psychologists or psychiatrists. So that's been really important.
But there are challenges to the system. If people need to stay longer, is there room for that? Dr. Liu says the workforce, insurers and payers, and the outpatient plan play a role in the stay.
There's not unlimited resources and it's costly. So I think sometimes having to justify that length of stay, there might be a disagreement at times between the clinical team and the payer. And eventually people do have to go out.
It's important to note there are resources available, including the hotlines on your screen right now.
I can appreciate that there can be a challenge to necessarily know how to navigate that system, but we do want to make sure that people know that resources are available.
Region 6 believes cost shouldn't be a barrier and has a network of providers for those with or without insurance.
Those providers in our area are available for outpatient therapy, for assessments, for substance use services, mental health, and dual diagnosis services.
Both UNMC and Region 6 aim to reduce the stigma surrounding mental health and encourage the conversation.
It's okay not to be okay. And it's okay to be able to ask for help with it.
Making sure that mental health is really treated, just equally importantly as physical health. And I think if we continue to do that, that's going to help with access.
Both UNMC and Region 6 mentioned the impact the pandemic had on expanding access to telehealth resources as well. For more information about resources available for anyone in the community, click on this story on our website. That's 3newsnow.com.